bring you in here because you are seeing a wide spectrum of things taking place across health, the MHRA, and vaccines, COVID. Tell us what you've been looking at.
Yeah, good afternoon. So I've not done a deep dive on anything in particular this week. I'm going to cover quite a few topics. And the first topic is always one close to my heart, and those are the board meetings. So we have got the latest NHS England board meeting now up, and also the MHRA board meeting. Now, I did a big write-up on the MHRA board meeting, but please, everybody watching, can you see there are only about 45 views? If you just click in and register your view, they need to know that we are watching them. Same goes for the NHS board meeting, which was only held a few days ago. But what I do need to tell you about the NHS board meeting is that last year, when people were booking for COVID injections and boosters, this year, they're going to be opening up flu and COVID clinics so you can book both jabs at once, regardless of whether they've been studied to be effective or safe together, regardless of which arm you're using. They're going to try and get you to the vaccination centre to have your jabs at once. They've also employed a diversity team for youngsters, especially youngsters with special educational needs. And it's a long board meeting. It's over 2 hours. They have a private board meeting in the morning and a dinner in the evening. So we only get to see the public board meeting. If anybody wants to know about the youngsters, the team for ethnic minorities, because they're saying that youngsters with learning disabilities, their life expectancy in the UK is only 35. If you want to see that, it's around 37 minutes on the video. And if you want to look at where you're booking to get all your jabs together on the NHS board, it's about 1 hour, 7 minutes. So you can page in to that. So please do look at the board meetings. Moving on, I just want to thank Louise very much, one of our viewers, for bringing this 7th jab to my attention. Now, I didn't know that this had been rolled out in 2022, and you'll understand why I didn't know about it in a minute. But it's the 7th COVID-19 vaccine authorised by the MHRA. This was authorised in December 22. Now, the reason it's different, it's called Prevotine Beta, and it's made by Sanofi Pasteur. But when you go and look at the medicinal product itself, you can see that this is a multi-dose vial again, 10 doses per vial. There can be no accuracy in, you have to dilute it, you have to mix it, you have to shake it, and then you have to get accurate doses. There's no way that anybody can do this. It's dangerous, in my opinion. But also you'll notice that it was produced by recombinant DNA technology using a bacillovirus expression system in an insect line. Now, this insect line is derived from the armyworm, but not only that, this injection has got squalene in it. Now, I didn't realise there was another injection with squalene, but it is. But if we look at the armyworm, there you can see it. I just went to Defra. It is a pest. The caterpillars are incredibly destructive. We don't know whether this injection, which is preventative for adults only, we don't know if any of these things have been cleared or cleaned. We have no clue. So please watch out for this injection because it seems to be doing the rounds. Jumping on to China, it would appear, I don't know if anybody has seen this story, but in Fresno, California, they've discovered what they believe is an illegal lab operating, which is linked to China. The CDC found 900 mice, genetically engineered mice, that were engineered to carry and catch the COVID-19 vaccine. But also in the laboratory, they found chlamydia, streptococcus pneumonia, Hep B, Hep C, herpes 1 and 5, rubella and malaria, and E. coli too, and keep a close eye on E. coli. Now, this apparently has been operating illegally since October 2022. So there's been Chinese police stations. Now we've got Chinese laboratories. So particularly concerning. And then I thought we'd go and look at flu because we're going to be coming up to the flu season soon. And the UK always keeps an eye on what's happening in the Southern Hemisphere. And this is coming from Australia, where they're having what they're calling a hard flu season. And they're calling for more antivirals to be used. Well, I don't think we want those, thank you very much, especially not for children. There's been 150,000 cases of influenza by early July. And they're looking at children, of course, aged 5 to 14 that haven't had the jab. So what happens in Australia, normally you can expect it to happen in the UK. And indeed, they are already getting ready in the UK. So the NHS are going to unveil special hubs because the flu season is going to be bigger than ever. Flu has definitely flown back. And of course, it's linking it then again to Australia. What's curious about this is if we remember 3 years ago, we weren't allowed to walk out of the door if we were suspected of carrying something. Now we're being encouraged to go to these flu centres if we've got flu or a respiratory condition, so we can sprinkle and mingle our bugs quite nicely. And that, of course, goes into line with now the CDC are likely to recommend an annual COVID booster. So this is going to be exactly the same as we had for flu, where everybody would go for their yearly flu jab. Now they want people to go for a yearly COVID jab. So that's something more to look forward to. But I would say to everybody, for anybody that's considering getting a COVID and a flu jab together, not that I suspect that any of you watching are, please do check patient information leaflets because none of these injections have been tested together. And you know that I'm always keeping an eye on E. coli very closely for a number of reasons. And here we go. This little park has been closed down because of an E. coli outbreak. Now, clearly what they're looking to do is children not to be petting animals. This is what I can see going forward. The UK HSA have already got involved. So keep your eyes on E. coli, especially in the UK. And then I do like to keep my eyes on Sir Christopher Whitty. And as an alumni of Gresham, I always look at Gresham, what they're bringing in. And it's very curious, I think, that sudden emergencies like nuclear or chemical incidents, earthquakes or floods, are being featured by Gresham this year. So medicine after disasters. So who's doing the lectures and when? So the first lecture you can look forward to. And Christopher Whitty, I have to say, normally does lectures on cancer or aging or dementia or air quality. So for him to be doing a lecture on reducing harms after nuclear, radiological and chemical incidents on Tuesday, the 28th of November, is fairly extraordinary. What does he know that we don't? But it doesn't stop there, because it seems Sir Christopher Whitty is also an expert in earthquakes, of which we don't get that many in the UK, only generally small ones. I don't think we've got any active volcanoes as far as I'm aware. And the last tsunami that affected the UK was in 1750 something. So I'm not quite sure why Sir Christopher Whitty is so interested in volcanoes, tsunamis and earthquakes. But it's not just that, it's floods. And of course, I am the expert on floods. I'd love to speak to Professor Christopher Whitty on floods. There's so much I could tell him. But he wants to tell us and all of you at Gresham in May next year, 2024. Why is he talking about all of these strange disasters?
Debbie, thank you very much for that. Well, incredible, isn't it? Because we've had Harvey Seligman pointing out, I'm going to call it the fiddling of figures to do with harms from vaccines. And then we've got all this fear-related stuff being pushed at us, connecting back into health. And if we think of Tony Blair in the sidelines, he wants to push a particular lady at us, Kate Bingham, who helped drive all of the vaccine agenda. And of course, she had a mere £670,000 to do so. An accident, a coincidence? I don't think so, but we'll come back onto this. Well, if you like what the UK column does, then please come and join us, join the community where you can talk to other like-minded people and share information. That's always a good thing. You can also support us by buying something from the shop. That would be kind of you. And of course, share the information that we're putting out, because one of our key objectives is to get information and facts and data out as far and wide as we can. Now, Debbie, 10 seconds on your blog.
Well, virgin births, disposable uteruses, Face Watch, Who's Watching You, World Coin, NHS, and Sir Chris Whitty, and a bit more.
Okay, lovely. Thank you very much. And we'll just put the advert up again for Saturday, the 26th of August at 1 p.m. Glasgow Green, that's a rally for peace and freedom, which has got to be a good thing. So if you can get to that and attend, please do. We're also going to put up that we've got an article here, an interview here, Amy Kelly, An Angel with Clout. And Debbie, you've been involved in this one, and you're back looking at Pfizer and BioNTech. And another one here, this is an interview coming out Thursday the 3rd, and that's tomorrow at 1 p.m, Master of Puppets, The Future of Britain, and that's with Ben Rubin. And also we wanted to put up an advert for the Great Net Zero debate. Sandy Evans doing a lot of good work there. And if you have a look at UK Column, you can see those. So please do. And finally, just in our ad section, Dr. Vernon Coleman has got a new book out, Unmasking the Globalists. We're going to do a review of that book and also in due course an interview with him. And last reminder again about Alternative View 13, Sunday, the 22nd of October, 2023. Where does that bring us? Well, I think it's going to bring us back to Vanessa, and I think you're going to take us